Hey yo, how's life? It's Busy Bee from Busy Business, and welcome back to another video. Here is a reading vlog, or currently it is around, well, when I recorded this, it was around like 9:38, I believe. I usually, at the end of like a long day, I usually try to read something either like related to my major or like what I'm learning, or I usually, if I really feel like it, I'll read something fun if I'm really not in the mood to doing anything extensive. I do this I try to do it every day. If I don't do it at night, I most definitely do it in the morning. And really for that, it's like, because I usually like to read before I start studying, because I feel like it helps me like get my mind ready for the reading and like even just like the curriculum that I have to do for that day, especially like anatomy. Like just reading, like say something like about like the body, or even like something related to nursing, because anatomy and physiology is kind of the basis for nursing, really gets me into that mindset and even kind of like motivates me to like do well for the day. And then kind of at night, it's just kind of like it's a de-stressor, just as like kind of self-care, kind of just taking care of myself. You also may be wondering why I'm doing a voiceover opposed to like the subtitles that I usually do. I feel like sometimes, like if I really want to just get a video out, or I'm just too tired or it's too late to do that, and I really need to like get up early, I usually will do just like a voiceover, just like get things kind of out of the way. Or maybe like as I'm talking, maybe put little like emojis or little words nearby, kind of like that one. But for today's video, it's kind of chillax. Right now I'm just kind of resting and stuff after reading. If you saw earlier, the book I'm reading is about the principles of public health, and I guess for this video I really just want to go into explaining what public health is to me, and like really to the world. So a lot of people hear public health and the first thing they'll think about is like nursing, doctors, medicine, stuff like that's really like involved with like healthcare, like people who are like you see like obviously engaging in it the most. But public health, the way it was explained to me and the way like I kind of describe it, is really kind of like, think of it as like a soccer game and stuff. Like obviously there are the players and stuff and the people who like obviously play soccer, but of course there's need to be like rules and like guidelines that each like team needs to follow in order for the game to run smoothly and to everything to kind of like work into a system. That's kind of what public health is. We're the people who like set the guidelines for like doctors and nurses to follow in order to keep the healthcare system running smoothly. And I feel like, especially with the pandemic, like public health has definitely gone into more view, and it's definitely become something that's a lot more important and stuff. And like, these days, I feel like the healthcare system is starting to get, if it doesn't already have, like a bad rap, especially with like the inequalities of certain people with certain, socioeconomic statuses and things of the nature. Like I said, I'm a freshman. I was a freshman, sorry. It's so hard to think of myself as like anything but a freshman, but I'm actually a sophomore, so this is my second year. You kind of like the first year went through the basics of like what's needed to know for the major. I'm sure this year we're going to delve more into like the other aspects that aren't really seen. But during this year, I learned a lot about like how certain behaviors affect like how like the decisions that they make about their health, and this helps people really try to especially public health officials try to determine the best course in like encouraging people to make smarter health decisions. Really learning about who is affected in the healthcare system, like those like African Americans, other minorities like Hispanics, like how they're affected. LGBT community, different like minority groups who aren't able to get the same access of healthcare due to lack of privilege that Caucasians might have. Learning about like environment and how the environment affects our health, how like the choices we make about our environment affect our decisions and our lifestyles. Really about like even as like healthcare professionals trying to learn about how we can be culturally sensitive and being culturally appropriate when dealing with people who may have different healthcare systems opposed to us. Really, that's kind of the basis of things of what I've been learning throughout this year. And I'm sure in another video I'm probably going to bring it up just because I'm running a little bit out of time. But I'm involved in other groups and stuff related to kind of promoting that same ideal of healthier decisions, especially during the pandemic, to kind of help us prevent the spread, encourage people to have like safer lifestyle choices and things of the like. So yeah, the purpose of me just reading this book, even though most of it I've already learned throughout the years, just kind of as a recap and kind of just to remind me of like why I'm here, what my purpose is, what the purpose of this major is, why it's going to be beneficial for me and for others when I graduate and stuff. And I think that's really the main purpose of like just these reading vlogs and stuff, kind of just doing that kind of stuff, and even just sharing it with like people who are interested in the field. Like say like if you're not interested in like nursing but you want to get involved in healthcare and really like make a difference on like a larger population, because like the thing with public health is like as you're a nurse you're like really care about a person or people, or not really people, like your patients, the people you're directly in contact with. Public health is a lot more broader. You're like really looking at a larger population of people who are mostly affected, and like kind of caring about people as a group opposed to like one individual. Like nursing, it revolves around typically one patient or the person you're dealing with. Public health, it's the world or a larger group of people. But yeah, that's kind of just the basis of what public health is, just because I know it's not really known. But I definitely wanted to just kind of explain it and stuff because, I feel like it is definitely getting a lot better over the years. But, it doesn't hurt to, explain it a bit more. But that's the end of today's reading vlog. I hope you enjoyed this video. If you do, please subscribe and follow. Stay busy and stay sweet like honey. See you guys next time.